Welcome to the training using the teach-back method to improve health literacy. Misunderstanding medical information is common, but it is no laughing matter. In fact, low compliance, poor health outcomes, and increased healthcare costs are all results of misunderstandings caused by low health literacy. Health literacy is defined as the degree to which people have the capacity to access, understand, and act on information to make appropriate health decisions. Health literacy is not based on education level alone, and it crosses all socioeconomic levels. According to the U.S. Department of Health and Human Services, almost 9 in 10 people don't have the literacy skills needed to manage the demands of the U.S. healthcare system. And we're not just talking about people who don't read well, didn't graduate from high school, or don't speak English very well. We are all part of the 90. And at any point in our lives, our health literacy level may be lower due to stress or distraction, unfamiliar information, or many other reasons. Now, many doctors overestimate a patient's health literacy skills and assume the information they provide and their instructions have been understood. Most patients don't even realize they haven't understood the instructions clearly, or they may be overly confident that they will remember important information. Regardless of our reading level or educational background, studies show that when we leave our healthcare provider's office, we immediately forget 40 to 80% of what we've heard. And almost half of what we do remember will be incorrect. In fact, the more information a doctor provides, the less we are going to remember. Your public health clients face the same struggle, so it's up to you to give them the best opportunity to understand and remember important information. This training will provide you with one effective tool to help your clients with low health literacy. This training module explains the teach-back method, demonstrates it in action, and gives you the chance to practice and improve your skills using the teach-back method. Let's start with a short introduction to the teach-back method provided by the Institute for Healthcare Improvement.
So teach-back is a way to check for understanding, and it comes out of the health literacy work. And there's a couple of different ways to do teach-back, but the important thing is to make sure that the responsibility for communicating clearly is firmly on the clinician, and that it's not a test of understanding on the patient or the client. So an example of how to ask the teach-back question is to say something like, we've been talking about quite a few different things, and I've given you some instructions about how to take this medication. Would you mind saying it back to me so I know if I was clear? So it's if I was clear. Another way to ask it is to really get a broader view of what they thought of the entire visit for like an appointment situation. So you might say something like, after you leave this visit, I know your wife's going to ask you, what happened today? What are you going to tell her? And then you can find out a little bit more about what they understood and also what they thought was important out of the visit. And then, of course, if you're demonstrating something like using an inhaler, it's the same kind of a thing, only it's show me. Would you please show me how you are going to use your inhaler so I know if I was able to make it clear? That's basically what teach-back's all about.
Teach-back method helps you ensure that you communicated clearly and that your client understood the information you provided. It's just one of several important tools you can use to improve your communication and help your clients with low health literacy. Other important steps to helping clients navigate through low health literacy include creating a shame-free, client-centered environment, listening to clients, using simple language, using visual cues, providing information for all adult learning styles, using the chunk and check method to break up complex information, and checking for understanding using the teach-back method. All of these techniques are described in the Health Literacy 101 training module, but this module will focus specifically on how to use the teach-back method with your clients.
Mrs. Smith, I know we've covered a lot, and I want to be sure I explained everything to you clearly. Can you tell me what you're going to do when you get home? When will you go to see Dr. Johnson?
The teach-back method allows public health and healthcare workers to use open-ended questions and check for understanding by asking clients to explain information and instructions in their own words. It provides a way to confirm what your client understood. It helps clarify key details with clients and make sure they clearly understood the information you provided.
I'm sorry, I must not have explained it all very clearly. What I actually want you to do is to call Dr. Johnson, your primary doctor, and make an appointment to see him, regardless of how you're feeling, within the next 5 days.
You can use the teach back method with any client encounter. After you've provided information, check for understanding by asking a question like this one. I know we've covered a lot of information. Can you tell me what you've heard? Or, I realize we just talked about a lot of things here, and I want to make sure I didn't forget anything. Can you tell me about the next steps I've described? I gave you a lot of information and I want to be sure I explained everything clearly. Can you tell me what you're going to do when you get home? I want to make sure you can call us when you need to. Would you explain how you will get a hold of me if you have questions? When you get home, how will you explain to your partner what we talked about today? And finally, what other questions do you have for me? Those are some examples of teach back questions you can use to check for understanding. Now let's watch a short video of the teach back method being used with a patient who has been newly diagnosed with asthma. Pay close attention to her language and to the questions she asks the patient to gauge his understanding.
So this is a meter dose inhaler, and what it does is it distributes a specific amount of medication into your lungs. So while I'm opening it, do you mind explaining to me what it is?
The inhaler helps release medication into my lungs.
Good, exactly. So this is how you're going to use it. You're going to take the cap off and you're going to inspect the mouthpiece to make sure that it's clean. You're going to shake the inhaler 10 to 15 times, and then you're going to connect it to your spacer. When you're putting it into your mouth, you want to make sure that you put all your lips around it, and you also want to make sure that your tongue is below or under it, okay? And you want to make sure that you close it around your mouth. So when you're going to spray, you're going to tilt your head back slightly towards the ceiling. You're going to take a deep breath in, and then you're going to spray. You're going to hold it for 5 to 10 seconds in your mouth, and then you're going to breathe out slowly, okay? And I just want you to remember that this is a steroid, so basically what it means is that after you have already sprayed it, it's really important that you wash out your mouth after. So you just want to rinse it with water, okay?
Okay.
So do you think you can explain to me how to do it?
Yeah, I think I can.
Okay. So would you do first?
So I'm going to inspect to make sure that it's clean and that there's no weird, like, fungus or whatever around it.
Mm-hmm.
And then I'm going to shake it 10 to 15 times.
Mm-hmm.
And then I'm going to attach the spacer.
Good.
I'm going to tilt my head up to the ceiling and then wrap my mouth around it with my tongue underneath and have a firm grip around it with my lips.
Good.
Then I'm going to take a deep breath in and then spray and then hold that breath for 5 to 10 seconds.
Good, good.
And then I'm going to slowly breathe out through my nose for about 5 seconds.
Okay, yes.
And then I got to make sure after I'm done using it, because it's a special type of medicine, that I have to rinse my mouth out.
Exactly.
Okay.
Great. Do you have any other questions?
No, I think I got it.
Okay, we'll be practicing throughout, and you can try it later on too,
Okay.
if you want to. Okay?
Okay.
Great.
How well did the nurse in this video use the teach back method? What other health literacy tools could she have used to make her communication more clear? She could have used more simple language. Instead of saying the inhaler distributes a specific amount of medication into your lungs, she could have said it puts just the right amount of medicine into your lungs. Instead of saying inspect the mouthpiece, she could have said look at the mouthpiece. Another thing she could have done better is prepare the client for learning. For example, she could say, today we are going to cover 3 things: how to put the inhaler together, how to use it, and what to do when you are finished using it. Then the client would have been listening for those 3 topics. She could also have told the client she was going to explain how to put the inhaler together in 4 simple steps. Then she could call out each step as she describes it. For example, step 1, take off the cap. Step 2, look at the mouthpiece to make sure it is clean. Step 3, shake the inhaler 15 times. And step 4, connect the inhaler to the spacer. She should have been more specific with her instructions. Instead of saying, shake the inhaler 10 to 15 times, she should give the client a single number to remember. Shake the inhaler 15 times. After she assembled the inhaler, she should stop and ask the client to demonstrate how he would put the inhaler together using the same 4 steps. Then she could summarize the 4 steps again before moving on to a new topic, like how to use the inhaler. To demonstrate how to use the inhaler, she should have prepared the client for learning again. She should have also used an illustration like this one to show the client where the tongue should be positioned, and then allow him to practice while she watched, so that she could make any corrections necessary. You can almost see the client's eyes glazing over as the educator begins describing how to use the inhaler. She's already given him more than 3 new pieces of information, which is usually the most any person can take in at once. She tells him to spray, but doesn't tell him to push the button to spray. She tells him to hold it in his mouth for 5 to 10 seconds, but isn't clear about what it is, the inhaler or the medication vapor. Then she tells him it's important to rinse his mouth because the medication is a steroid, but she doesn't explain what that means or what the risk may be. Her teach-back question is not open-ended and could be answered with a yes or no. Do you think you could explain to me how to do it? The client does do a good job repeating her instructions, even using simpler language than she did. Finally, she asks, do you have any other questions? She should have used a more open-ended question like, what other questions do you have? She finishes by telling the client they will practice later, and he can try it if he wants to. It would have been better to let him demonstrate how he was going to use the inhaler while he was right there in the office, so that she could make any corrections that are necessary. Now let's watch a second demonstration of the teach-back method. This is a video from Truman Medical Centers showing a conversation between an emergency room doctor and a patient who has come into the emergency room with difficulty breathing due to heart disease.
All right, Chris, so you came in today for an urgent care visit because you're feeling more short of air. And after examining you and looking at everything, we feel like the shortness of air is probably because your heart failure is a little bit worse. Today is Monday. Our plan is to help with the shortness of air and to help with your heart failure. I want you to double one of your medications. So you told me that you've been taking Lasix 20 milligrams every day. I want you to start taking 40 milligrams a day. So you're going to take 2 tablets every day. And then and you're going to take that every day for the rest of this week. And I want you to come back on Friday and see me again. The reason that I'm doubling the Lasix is because the Lasix helps pull the fluid out of your body. I think the fluid is what's making you feel short of air, and the Lasix will make you pee more frequently. And I think that will help with the shortness of air. Now you are pretty short of air. Your weight is up a lot, and so you are sick. I am concerned that if things get worse, you might need to get admitted to the hospital. So if you start having chest pain, worsening shortness of air, or if your weight goes up, I want you to either give us a call or come to the emergency room because I want to know that that's going on. Okay? So I just threw a whole bunch of information at you. Can you explain back to me what the plan is and what we're going to do this week for your shortness of air?
So, because I've been having more trouble breathing, you think it's because of my heart, and so we're gonna double one of the medications I'm already taking.
Yep.
And if it makes me start to need to go to the bathroom more, I'm supposed to go to the emergency room and then call you guys.
So actually, we expect the medication to make you pee more. So that's how it works. That's how it gets the fluid out of your body. So we want it to make you pee more. But if you start feeling worse, if you get shortness of air or chest pain, those would be reasons to go to the emergency room. Okay. And I want to make sure that I did a good. I don't know if I mentioned what the name of the medicine was. So do you know which of your pills it is that you should be taking 2 of?
So I'm supposed to be doubling, taking 2 of my Lasix.
Exactly, perfect.
And it's probably gonna make me need to go to the bathroom more. And then if I start to have like chest pains or like it hurts here, or if I'm like the breathing, my shortness of breath gets worse, then I'm supposed to go to the emergency room.
Exactly.
And then I'm supposed to come see you on Friday.
Right.
Okay.
And we'll check up and see how everything's doing. What other questions do you have?
I think that's it. Are you guys gonna give me like this information?
Yeah, I'll give you some patient education about heart failure and things to look for, and put it with your deep heart information. Okay. All right.
Okay.
All right. Well, it's good seeing you today. I'll see you
Thank you.
again. All right. Thanks.
What were the strengths and weaknesses in this interaction between provider and patient? She used simple language, spoke clearly, and repeated key information. She said she was going to double one of his medicines, then explained the dosage would go from 20 milligrams a day to 40 milligrams a day. Then she told him to take 2 tablets instead of 1. She basically repeated her instructions 3 times using different words. Give an example of how the provider used simple language. Instead of saying difficulty breathing or shortness of breath, she used the phrase short of air. Instead of telling the patient the medication would cause frequent urination, she said it would make him pee more often. What was the patient's misunderstanding about his medication? And how was the provider able to catch and correct that mistake using the teach-back method? She used the teach-back question, so I just threw a whole bunch of information at you. Can you explain back to me what the plan is and what we're going to do this week for your shortness of air? She listens to the patient and corrects his misunderstanding. He thought if he had to pee more often, he should go back to the ER. She corrects him. We expect the medication to make you pee more often. That's how it works. We want it to make you pee more. But if you start feeling worse, like chest pain, shortness of air, those would be reasons to come back to the emergency room. Then she uses the teach-back method again. I want to make sure that I did a good job. Do you know which of your pills it is that you should be taking 2 of? He then repeats the full plan and gets it right this time. She ends the session with one more open-ended question. What other questions do you have? He doesn't have any, but he does ask for the information to be provided to him on paper. Now, these videos are both good examples to learn from, with the second video being the better model. You may not feel comfortable today using the teach-back method, but as you practice, it will begin to feel less forced and more authentic, a natural way of communicating. So now it's time for a role play to give you some practice. I've provided 3 scenarios. Choose a coworker or a family member to be your client. Deliver the information with clear communication, and then use the teach-back method to see how well the client understood you. In the first role play, you will explain to your client how to tie the laces on a tennis shoe. Now remember, adults learn in different ways, some by listening, some by reading, some by watching, and some by trying. Since you can't tell which way your client learns best just by looking at him, try to incorporate all 4 learning styles in your instructions, and then check for understanding using the teach-back method. When you've completed the role play, evaluate yourself using the teach-back self-assessment tool. The person who played the role of client can offer you feedback as well on the client feedback tool. Talk about the experience and identify ways that you can improve your skills using the teach-back method. Then try the other 2 role play scenarios. In the second role play, you will explain to your client in detail how to make a peanut butter and jelly sandwich and then cut it into 4 equal pieces. Make the information easier to understand by preparing your client for learning. You can explain that you will describe 4 steps to make a PB&J. Use step 1 is in your instructions. Then check for understanding using the teach back method. In the third role play, give your client directions for driving from your office to the nearest hospital. Remember to prepare your client for learning by describing the major points you will cover, and then use the teach back method again to gauge for understanding. Now, these role plays are intended to be fun, but remember the same health literacy principles apply whether you're teaching someone to tie a shoe, choose healthy foods, or manage active tuberculosis. As you continue using the teach back method, you will find it easier and more natural to integrate seamlessly into every client encounter. You may even find it helpful outside the office, like when you're giving instructions to your children or grandchildren, or when you share information with your spouse. Check your skills often using the self-assessment tool. Remember, practice makes perfect. Now, since you can't tell a person's health literacy level by looking at them, it's important to remember that we all have times when our health literacy level is low. So use simple language and check for understanding using the teach back method. Your efforts will help ensure your clients are better able to access, understand, and act on the important health information you provide. Information that will help them live a longer, healthier life. You've just completed the training module using the teach back method to improve health literacy. Please take the post-training quiz at bit.ly/teachbackquiz. Thank you.